Good morning, everyone, and welcome to a special VoteVets Live with Senator Jon Tester, ranking member of the Senate Veterans Affairs Committee. Today, we're going to talk about what the Affordable Care Act means to veterans across the country. So let's go ahead and dive right in. Jon Tester is a third-generation Montana farmer, a former school teacher, and Montana's senior U.S. Senator who has deep roots in hard work, responsibility, and accountability. As ranking member of the Senate Veterans Affairs Committee, he's committed to ensuring our nation's veterans have access the quality health care and benefits that they've earned. The senator's very first legislative victory in the U.S. Senate was successfully raising the veterans' mileage reimbursement rate for the first time in decades. And since then, Senator Tester's successful work for Montana's and America's veterans includes increasing veterans' access to health care and mental health services, reducing red tape and the benefits process, and creating more job opportunities for veterans. Senator Tester, sir, good morning. How are you today?
Couldn't be better. It's great to be with you, Will. I consider it a high honor to be able to talk about healthcare for our veterans in this country. So thank you.
Absolutely. Thank you, sir. And I want to dive right in with a few questions about the Affordable Care Act and how it factors into the overall picture with the VA and other healthcare systems in our country. And starting with the ongoing attempts by some to overturn that law and what it would mean for veterans. Obviously, the ACA was a landmark bill when it came to improving healthcare access and affordability across the country. And the number of uninsured veterans has dropped by almost 40% since it passed. Nonetheless, the Department of Justice has been in court trying to invalidate the ACA. From your view and your perch on the Veterans Affairs Committee, what would that mean for the more than 13 million vets who receive some form of healthcare coverage outside of the VA system?
Well, Will, I will tell you, first of all, ripping away healthcare in general is irresponsible or cruel. Ripping away from veterans and all that they've given to our country compounds that. Look, it has major effects for our veterans. 1 in 10 non-elderly veterans would lose coverage from repealing Medicaid expansion alone, which is a part of the ACA. They would lose access to enhanced health benefits and protections that are included in the Affordable Care Act. Furthermore, if you're a self-employed veteran or a veteran small business owner, you would lose access to the affordable health coverage through the ACA's marketplace and putting veterans' access to health care at risk. And as I said, remember, we're in the middle of a global pandemic. And then we have roughly 9,000 veterans in Montana alone that could have their access to the health insurance premium tax credits jeopardized. So the list goes on and on. We've got 11 million veterans who are Medicare beneficiaries who will see their Part A and B premiums rise as the ACA's cost savings measures are erased. And by the way, from a Montana perspective, this includes almost 47% of Montana's veterans who are 65 or older. Those veterans who rely on Medicare, for example, for their prescription drug benefits will see out-of-pocket costs rise once again due to the reinstatement of that donut hole. And quite frankly, there is no doubt that the cost of prescription drugs is too high. Repealing the ACA would only make that worse. Especially for veterans whose costs could fall into the donut hole that I just mentioned. So, look, repealing the ACA from a veteran's perspective would be disastrous. And you know, I know we all think about, you know, veterans just get their health care through the VA, but there's a lot of them get their health through the VA, but there's a lot of them that get their health through Medicaid, Medicare, the private sector. All those veterans are going to be impacted very significantly. And it's a large number of the veterans population in our country today.
Absolutely, sir. And we remind people a lot when we have these kind of discussions that, you know, a lot of people, myself included, have a covered condition where they receive a segment of, you know, care specific to an injury through the VA, but then have to rely on, you know, private insurance for the rest of that care picture. And I want to talk about some of those communities that you touched upon in your answer there. Obviously, the ACA has been key to including or providing healthcare for people regardless of where they live. in veterans, whether they're in a big city or in a rural area. States that have expanded Medicaid coverage under the ACA have seen rural hospitals bolstered to stay afloat. There are more than 5 million veterans who live in rural areas. You represent many of them yourself. How important is this law, the ACA, to ensuring access to healthcare for rural veterans?
So you're absolutely correct. There are 5 million veterans that live in rural areas. In Montana, nearly half of our veterans live and reside in rural communities. If you are in a rural community, I don't need to tell you that you need every option out there available to receive healthcare. Make no mistake about that. It's a challenge, oftentimes, to access healthcare in rural America. The only thing that is out there that is a bright light, and I will say that the VA has done some good work. We've opened up some community-based outpatient clinics, but you need more than that. And these rural hospitals that are out there are struggling to keep their doors open. If the ACA goes away, I think we will see many of those close, including potentially the one in my hometown that is like so many rural hospitals around this country. What does that result in? That results in, I got a sneeze coming on here. It'll go away. All right. That results in much longer distances to travel, less access for our veterans that live in these rural areas. And I will tell you that Medicaid expansion, for example, we've seen a drop. I think you mentioned this actually in your opening. We've seen a drop of almost 40% with Medicaid expansion of uninsured vets across this country. Many of those live in rural America, where poverty is something that exists and exists in a big way. So look, as with healthcare, if you don't have two things, affordability and accessibility, you're kind of in a tough situation. And for our veterans that live in these rural areas, those rural hospitals are critically important. And I can tell you, it is not just a guess that these hospitals would close. They would close. And there's no ifs, ands, or buts about it. That charity care would go up to the point where they couldn't afford to absorb those costs. And they still have the bills that they have to pay. And quite frankly, Medicaid expansion has helped them serve everybody, including veterans, and get paid for those services. So appreciate that question, Will, because it's something that's really close to my heart.
Absolutely, sir. And something else I know is close to your heart, has been a focus of your work, is the number of Native American veterans across our country. The Pentagon, in their own statistics, says that they have one of the highest representations in the armed forces. The Census Bureau estimates there are more than 150,000 Native American veterans across the U.S. The ACA also included permanent reauthorization of the Indian Healthcare Improvement Act, which extended existing law and also authorized some new programs and services within the Indian Health Service. Could you speak to the importance of those provisions to delivering the best possible care to Native American veterans across the country?
Well, first of all, we need to understand that Native Americans serve at a higher rate in our military than any other minority in this country. They step up. When we need folks to serve in our military, Native Americans are there. And they're there in higher numbers than any other minority. The fact is that they have health challenges. Our Native Americans, particularly in this pandemic, they're seeing incredible challenges with COVID-19 and disproportionate impacts. No ifs, ands, or buts about that. Whether you're a veteran or whether you're a non-veteran, if you're Native American, you're seeing impacts in your communities that are incredibly concerning. So they need access to healthcare. We talked about the rural hospitals. That applies in Indian country too. But you talked about the Indian Healthcare Improvement Act. Now, I've been around here for nearly 14 years, and I can tell you that we worked hard to try to get the Indian Healthcare Improvement Act passed, and we could never get it passed. We got it passed as part of the ACA. And quite frankly, this is the backbone to Indian Health Service, urban Indian health centers, the Indian health system across this country that serve veteran Native Americans and do a damn good job, quite frankly. Their only challenge has been dollars. And if the ACA is repealed, the increased reimbursement levels for these folks who qualify for Medicaid expansion, that get their health care through Indian health centers or the Indian healthcare system, would be severely reduced, and just as in the rural hospitals, puts them at risk of closure. And quite frankly, it is something that is huge in Indian country, because access to healthcare is a challenge all the time, and a repeal of the ACA would just make it all the harder for our Native American veterans to be able to get their health care that they need to fix their challenges that are out there. And their challenges are significant because, quite honestly, there's some poverty issues in Indian country, and quite frankly, the ACA has helped with that, to be able to get them access to healthcare, whether it's through Medicaid expansion, whether it's through IHS, whether it's through the marketplace plan, whether it's through Medicare. The bottom line is that we need to serve all our veterans in this country, and Native Americans cannot be left out. They were not left out in the Affordable Care Act. They were specifically addressed in the Affordable Care Act. If the Affordable Care Act is repealed, that all goes away. And it puts our veterans who have served so proudly in our military, that are Native Americans, as well as a whole lot of other veterans, at risk.
Absolutely, sir. And you touched a little bit there on the impact of COVID-19 on veterans' health and VA systems across the country. VA has worked really hard to handle the impact of COVID. We've heard a lot of stories, read a lot of stories about really heroic efforts by medical employees, doctors and nurses being heroic on the front lines. One thing we've also heard from medical professionals is that we don't know what survivors of COVID-19 may face down the road, things that could become future pre-existing conditions. So 2 questions for you on COVID. One, are you worried about the possibility of pre-existing conditions or things that could make things worse for veterans who may have respiratory issues from burn pits, et cetera? And then second, more broadly, what do you think the VA needs as we head into the fall and winter when it comes to battling this pandemic?
Well, first of all, I want to echo what you said about the frontline employees that are under VA. They're some of the most amazing medical professionals that we have in this country, and we're damn happy to have them. And they work hard, and they're committed to America's veterans up and down the line. So I want to echo your kudos to those folks. But I will tell you that this pandemic has stretched everybody to the limit, including the employees at our VA facilities. The issue really becomes here, though, is that we don't know all the impacts of COVID-19. We just don't. We're finding new things out about this pandemic every day. The medical researchers are finding out stuff that they never thought existed 6-8 months ago. And we don't know at this moment in time what kind of long-term impacts are going to be felt by the people who receive COVID-19. In other words, they could well have a pre-existing condition just because they got COVID-19. And if the ACA is done away with, pre-existing conditions go away. And I know there's been a lot of conversation out there about, oh no, we're for pre-existing conditions. We're going to make sure that they're taken care of. I have yet to see one single plan to take care of the folks with pre-existing conditions, veterans or non-veterans. And by the way, veterans are at more risk than the non-veterans, because oftentimes they come back with comorbidities from being in theater that other people aren't exposed to. So it just compounds it for veterans. And if the AC goes away, the coverage for pre-existing conditions go away. And quite frankly, that puts our veterans at an incredible disadvantage in the marketplace, along with a lot of other folks too. So we need to make sure that this doesn't happen, quite frankly, because it would be disastrous. Going forward on the pandemic, I think that we have learned some things from this pandemic. There's stuff yet to be learned, but as far as the functionality of our system, we have learned where our weak spots are. And I think what this has shown us is that we need to do a lot more with telehealth. We need to really invest seriously in broadband when it comes to telehealth, That includes telehealth that our facilities that our veterans utilize, because quite frankly, that can help a veteran not get exposed to this pandemic by staying at home, dealing with whatever issue you might have at home via telehealth services. So we need to do that. The other thing that it helps with a lot is we talked about those staff, and it reduces the risk for the staff too, because folks can get their health care at home, literally at home, not even get in the car. You talk to a person just like we're talking right now, Will, a medical professional, and get that done. The last thing is we need to make sure that our providers, our staff have the personal protective equipment that they need. The flu shots are readily available and promoted to the veterans and the staff. I think this is all really, really important moving down the line. So the pandemic has shown us a lot, and it has shown us how important this ACA is. We knew it was important before, but it was really compounded.
Absolutely. And thank you so much, sir, for your time this morning, talking to us about these issues. And as you've alluded to in all of your answers, these are really complex issues. And I know that our supporters are so grateful to have your leadership and the leadership of the folks you work with in the Senate fighting for veterans every day. So thank you so much, sir.
Will, like I said when we started out, it's a pleasure to be on. I can tell you that I know there's a lot of folks out there that aren't veterans that think, oh, don't worry about the veterans, they're taken care of by the VA. That's not the case at all. Truth is the VA provides some great services, but there are a lot of wraparound procedures and coverage that the veterans still need that are provided by the ACA, that if the ACA wasn't there, they wouldn't have access to. So thanks for your ability to get this message out. I appreciate it very much.
Absolutely. Thank you so much, sir. We'll hope to see you again soon. And thanks to all of you for watching this morning. As the senator told us, we need your voices now more than ever, telling your friends and neighbors about what access to affordable healthcare means to you and your family. If you haven't already, you can join us at votevets.org and share your story. Stay safe, and we'll see you again soon. Thank you so much, sir.